All right, we've had a few more people join up. We're going to get started in about 2 minutes. And get ready. We got a lot of ground to cover, talking about synergies between microneedling and other procedures, and a couple other little surprises thrown in. All right, well, I'm going to get off to a slow start. For those of you who've been to this webinar before, you know who I am, but just in case anybody is new, if you are, welcome. And it's a pleasure to have you. And I am an OBGYN. I am based in Georgia. My main practice is in the Athens, Georgia area. Go Dogs. We had a close call last week, but prevailed. And OBGYN by trade. I quit OB in 2005. I used to be on the faculty at Emory University and started in aesthetics actually as early as 2002 with Botox and fillers, right when they got approved. And founded Practical CME Medical Training in 2008, mainly because I struggled to get good training in a lot of these procedures that are very evidence-based, but the training was pretty lousy. So we have an all-MD faculty. Everything is CME accredited. We also wrote and got the very first CME accredited course in PRP and microneedling. Aha, and that's where we get the idea of synergies. Because actually, when we first discovered microneedling, it was due to the synergy with PRP. Now we know microneedling is an amazing standalone too, but that's how I was introduced to it. And that was 10 years ago. So a couple things I want to do before we get into synergies is talk about a few things about microneedling in general, because I know a lot of people here have not purchased equipment yet, or they may, as I learned last week, they may own equipment that is not FDA cleared yet, and they are using it in practice. And since 2018, microneedling equipment in the United States has to be FDA cleared, especially if you are going to use it in the treatment of patients. And this is a slide from our training course where you can click directly to the FDA and check the 510K status using product code QAI of any microneedling device out there by name. So go look up anything that they're selling on Amazon and you will be surprised. You're not going to find it there. In fact, best of my knowledge right now, there's only 6 devices in the US that are FDA cleared, and these are the 6. SkinPen was the first. No stamp or roller, to the best of my knowledge, has been FDA cleared yet, and therefore you should not use them in treating patients, because if that patient has a bad outcome, you have no leg to stand on using equipment that is not FDA cleared. So that's really important. You are professionals, and we need to do that. So if you are currently using a device that is not on the list, you want to seriously reconsider that. I discovered this device last year when it got its FDA clearance and was pretty much blown away. I've called it many times the iPhone moment for microneedling devices, because you have this incredible digital interface, which is accurate, it's smooth, it's predictable, it runs really well, but you also have the App Store that is the DP Derm family of products and serums and home care that you can use. The beauties of this pen that make it class leading is it's the only one with a digital direct drive, meaning it pushes the needles, but also pulls them out. It doesn't depend on a spring. It also is class leading for cost, around $26 per treatment when you buy the box of 33 needle heads. It has 2 swappable batteries, or you can use it corded, so you're never going to run out of juice. Only one other pen has swappable batteries like this, and you can't use it corded at the same time. Depths to 3 millimeter for scars, and an extra few needles just so you can get better penetration as you go. So what we want to talk about tonight are these synergies between microneedling and especially platelet-rich plasma and topicals. And there's an emerging area of topicals called exosomes that I'm going to introduce you to tonight. We'll talk about it in bigger detail later in another webinar, which are kind of a bit of a bridge between platelet-rich plasma and topicals. So no needle, no blood draw is involved. But we're also going to talk about synergies as far as upsells go, and I'll share with you some of the statistics from my practice about the incredible synergies between microneedling and Botox and dermal fillers in terms of frequency of use, where patients want to do both. And then we're going to talk about some antagonistic relationships a little bit as well. So let's start by talking about what is platelet-rich plasma. So when you look at this tube on the right and you spin it down, all the heavy stuff goes to the bottom. Those are the red cells. They are useless in aesthetic medicine. All the plasma goes to the top. That's the water, the albumin, the sodium, the potassium, the electrolytes, the hormones, and things like that. And then all the cellular elements are in that little line in the middle. It's only about 1% of the blood. When I say cellular elements, I mean things with nuclei and DNA. Those are the real interesting things. So you take that line and blow it up into this graph, and you see that some of the lighter things like the platelets, the monocytes, and the lymphocytes are all, we've talked about that in prior webinars about these are good, these are not pro-inflammatory, and platelets have growth factors that we want to preserve. So we want to preserve everything below 1.075 or so, and we want to reject everything that's heavier. And that's the whole point of PRP equipment. And the reason for that is platelets have a tremendous amount of growth factors in them. And these things called alpha granules in the bottom left of the screen, you have a lot of growth factors that enable healing. You know, a lot of us who maybe were asleep during that part in medical school, and I like to joke that I think it seems like when we learned about platelets, it was a Friday afternoon at 3 p.m. back when I was in medical school. But I really had no clue until looking back at this how much of a role they play in healing. They heal the tissue. They attract new blood flow to the area. They don't just form a clot and stop you from bleeding to death. And these growth factors are very important. And the whole idea of platelet-rich plasma is to say, well, what if we can take these growth factors that are present in injury and try to heal tissue that is just maybe a little old, a little bit, losing a little bit of its volume, and try and perk that up without injuring it. So that's healing without injury. And that kind of proved to be something that works, as we've learned so far this century. And the Kakuta study here shows the incredible concentration of these growth factors when you spin blood, get the PRP fraction, and then do what's called activate it. Activating is extremely important because you're injuring the platelet granules, so they release these growth factors so that they are free to then go to the tissue and stimulate fibroblasts and adipocytes to make the tissue look younger over time. So it's unequivocal how many growth factors you get out of this activated plasma. But that's not just enough, because you have to show that platelet-rich plasma actually stimulates the target cell. So they took it one step further and took that activated PRP and worked on cell cultures of adipose-derived stem cells and fibroblasts, the things we need to make more collagen and elastin and hyaluronic acid and more fat, because we may be gaining fat everywhere else in our body, but as we age, we lose fat in our faces. So again, you're seeing this triple to quadruple effect of platelet-rich plasma versus just whole blood. But the thing is, you got to make sure what you're isolating is really platelet-rich plasma. And that's why we had the first CME accredited course on it, because we finally dug through the literature and gave everyone a blueprint on how to do that. Not the salesman approach that, oh, just get one gel tube and spin it and call everything PRP, but the actual science behind it. So what you do is you draw blood up into one of these special FDA cleared, because just like microneedling pens have to be FDA cleared, so do PRP kits. And we go over in our PRP training course which ones are and the pros and cons of each. You spin it, and then what you do here in step 2 is you skim off the platelet pore at the top. If you notice, that's fairly translucent highlighter yellow. Then you invert what's left, and that's more turbid and cloudy, and that's where your PRP is. And generally, it's not PRP if you're not discarding at least the top the top 2/3 of the gel tube. So the top 2/3 must come off before you can call it true PRP. Otherwise, it's just too dilute, and you're not going to get that effect on your intended cells that you expect. Sadly, most people out there doing PRP use the entire gel tube and call it PRP, and they're getting only a 1.6 concentration, which is not what they did in the Kakudo study. Back in 2014, we had Kim Kardashian getting the blood facial or the vampire facial, and this went very as viral as things could go in 2014. And you notice they managed to not put any plasma near her eyes, so you could be sure it was her, and they got the bloody towel next to it. So this is strictly marketing. In fact, really good PRP doesn't have to be this bloody. The more red cells in it, that means the more neutrophils you have. That means the more pro-inflammatory it is. So we now know that this isn't exactly what we're going for. But that being said, the synergy of properly made PRP with needling has been shown, fast forward 10 years, to be a really good adjunct when treating scars and scalp. Okay. As far as pigment and fine lines and exfoliation and acne other than scars, wrinkles, any kind of sun damage, I haven't seen that level of proof that PRP is that good of an add-on for the cost. So that's why I put the third point on here, vanity. Some patients still want this. They want the idea of doing a blood facial and walk out of the office with the clotted plasma on their face and hope they see their friends in the supermarket. I'm not going to tell them no, but I also don't push it. That being said, it's a fantastic add-on, and I have seen great results in my practice when combining microneedling with PRP for scars and definitely for scalp. But that's not the only use for PRP. As a topical, you're also injecting it. And the same thing is true. You can inject it for scars and scalp as well. Here's a part of one of our training videos from our CME course on how you inject it into the scalp, but also for volume loss. So while it is not a filler in that it is not going to take up space by itself for 9 to 12 months, if you want to get that synergistic effect, you're working on the outward appearance of the skin with microneedling, but you want to work on some of the folds and the wrinkly crinklies around the mouth and the volume loss in the cheeks, temple area as well. You inject platelet-rich plasma that is activated into the fat to then trigger more fat. Another great place is tear troughs, orbital hollow. A very dangerous place to use static fillers due to embolization and potential for blindness, but a good place to use PRP. So you have this other facet. You can use it topically. You can use it injected as well. These are slides from our training courses. Some of these are in the microneedling course. Some of these are in the PRP course. But lots of data where PRP treatment of scars improves the outcome of CO2 laser treatments. I think microneedling is now the gold standard, and I would never buy a CO2 laser to treat acne. These are older papers, but PRP was a synergy there. It's a synergy with needling, as you see with the second paper. Couple of split face studies showing PRP with needling is superior to their controls. Again, these are small. Generally speaking, treatments are done monthly here. I think we've learned more since 2015 that maybe you can stretch that out to every 6 weeks, get a little more bang for your buck, as the healing process may go a little longer than 4 weeks, especially when there are scars involved. We talked about that last time a little bit, but also with hair. I don't like to advertise when I work on the scalp as hair growth. I like to call it scalp rejuvenation, and whatever density we get with hair is a nice bonus. That being said, we do have good data that PRP is helpful. It can be used as a, hold on a sec. I just lost my screen. Can I get some, can people see my screen now and hear me? I don't know why we had that little, can I have some confirmation that people hear me?
Yes, we can hear you.
Okay, sorry. I must have had a I think the video driver decided to reset, so I'm just going to come back on here and continue. Sorry about that.
We just had some lightning, so I think that might have something to do with it.
Oh, wow. Okay.
Power flicker.
All righty. Oh, my camera's out, but as long as you can see the screen, that's cool.
Yes, we can see the screen.
All right, beautiful. All right, we'll keep going. All righty. So this is the type of effect you get when you microneedle the scalp. And I will not just inject PRP into a scalp. I will always microneedle through PRP as well. That's a given because I believe the microneedling is what's really pulling the weight in the scalp. I think the PRP is a great boost to it. But you have this paper here again with PRP improving hair density as well. So, and like I talked about last time, when you're trying to look at PRP in the medical literature, there are a lot of issues in that the studies aren't as good as you'd like them to be. Like this was only a very weak concentration of PRP, and it was only a single spin. So that being said, I think if you have a lot of patients who are over 45, over 50, want to try and get volume in their faces, maybe they're not getting the benefit of fillers, or they don't like the fact that when they get fillers that their face just gets a year older after the filler goes away. PRP is a nice synergy because PRP not only synergistic topically with microneedling, it's also synergistic with dermal fillers as well. The next biggest synergy I want to mention, of course, with microneedling is the topicals. And I would go so far to say that a properly designed and administered topical strategy is half the benefit of the entire procedure. So if you're really not putting much thought into it, or you're just microneedling through glycerin glide and telling people to go home and use some vitamin C serum they bought on Amazon that's 2 months old, you're really missing half of the benefit, because they can continue to support that scarless healing process that we talked about in the last webinar. They can work on down-regulating melanin. But the cool thing is that you can choose the topical you want based on the patient's needs. And if the patient has multiple needs, you can alternate those topicals between adjacent microneedling treatments as you go. I showed this slide last time. And when you look at slides A versus C, that's the difference just from microneedling alone. But when you look at slides C and D, that is the advantage of doing needling with topicals. You see there is a lot more, really, like I said, 50% more stimulation of new scarless collagen. Hyaluronic acid is an extremely important topical. And luckily, if you stay within the DP Derm universe, you will be getting the right kind of hyaluronic acid. But if the hyaluronic acid you're using in your practice is runny and almost like water, like some of the dropper bottles that you can get online, that's low molecular weight or digested hyaluronic acid. You can even go to some of the good, so-called good skincare providers and pay $50 or more for a tube of hyaluronic acid, and they might say on the back that it's digested. That's another term for low molecular weight HA. And so that is very pro-inflammatory when it gets into microneedling channels. And your microneedling channels are going to stay open for about 3 days. So I really like that this study really got down to that. And the high molecular weight hyaluronic acid is what you want to use exclusively as your topical. Even if this was your only topical, say with vitamin C, you've got about half of the topical benefit maybe there for just general anti-aging, but you don't want to use the wrong things here. And that's why I have seen the most renewals of treatment packages I've ever had in my practice since switching over to the DP4 pen and the DP Derm cosmeceuticals. because people get results really fast and they are eager to see what the next 4 treatments are going to give them. And I think a lot of the secret is in these Mesoglide serums that you have. All of them have very large hyaluronic acid built in called Hyalofuse, but also a lot of other healthy ingredients that we talked about last time that have been shown in the literature to be supportive of, again, that scarless regeneration of tissue. And you have 5 choices, including an exosome choice I'll talk about in a bit, that are tailor-made for general anti-aging, accelerated anti-aging, scars, pigment, or acne. And the other thing is I don't want you to think the products are expensive. You know, I don't want to just break here and talk about money, but I came over to this product from SkinPen, okay? And SkinPen was charging me $60 for a needle head with a little tube of glycerin glide at the same time. And compare that now to doing a DP4 treatment where I'm paying $26 for the needle head, but I can also use MG serum, and I'll use half of one of those little vials per case. And then I'm going to give the patient one of these home care starter kits. And they will use that, split it up over the 3 treatments to use at home. And by packaging all of this into their package price, I've actually still lowered my wholesale cost of doing a treatment, yet the patient now gets a more superior product synergy. Now I want to talk a little bit about exosomes. We're going to go into more depth later on, but you want to have this on your radar. You know, exosomes could very well be, you know, over the next few years, kind of how the same way we look at PRP now. And what exosomes are is they are growth factors and a lot of natural nutrients that are packaged inside a vacuole or an EV, an extracellular vesicle. And these are nanoscale vesicles that are made by cells. Generally, they are derived from mesenchymal stem cells. And the little vacuoles that these things pop off are really fascinating in that they contain a lot of the same growth factors as PRP, but a lot more variety. But the beauty of these is, again, like we talked about with PRP, you have to eliminate the granulocytes and the red cells because they stain and are very antigenic. Same thing's true here with these guys. You want to make the right exosomes that don't have a lot of antigens on the surface. And we think we've gotten to that point now where we have the right cell lines and the right ability to do it. Now, you can engineer an exosome too. You can put them in a gel and they become shelf stable. So you have the opportunity to put growth factors in the skin topically and needle through, and then rub them into needled skin without having to draw blood first. So this looks really promising. And this just shows you kind of how we make an exosome. And the contents are very varied. You see an awful lot of different growth factors there. And that's what's exciting about this, is that the possibilities are endless. And right now, DP has a new exoskin product, a new exoskin formulation that uses the HLA-G protein, which is really, really low in antigenicity. And they also have these MG treatment serums, which you can offer as an upgrade from the other treatment serums. Now, instead of $12 a treatment, the wholesale cost is about $60 a treatment, but it has that extra benefit of delivering growth factors that none of the others will do. And we are hopefully learning about which patients are going to do best with exosomes. I imagine the older you are, the more likely you'll need the extra boost of exosomes. This just gives you an idea. Remember, I showed you some of the growth factors that are present in plasma. You can see the growth factors that are in the exoskin product as well. And you see a lot of similarities. And if you recall from the last webinar, FGF7 is extremely important for helping to modulate pigment by helping to grow new keratinocytes that don't have pigment in them. And so there's a lot of things. TGF-beta-3 is also extremely important for scarless wound healing. So again, really exciting stuff. over time, we will answer a lot of these questions. Question 1, what's in it? We got that. I just showed you on the last slide, so that's excellent. What source is the best that has the best tropic effects and the lowest inflammation? I think we know that too. And that's the amniotic source and the protein that's in the exoskin. Now what we're got to do is do the same things we did with a lot of our other topicals and actually get some clinical trials in, possibly some split face studies, maybe compare it to PRP, compare it to topicals, the vitamin serums alone, and also try and see evidence of these exosomes getting into the microneedling channels, just like we have tried to do in the past with other topicals. So it's really interesting. Stay tuned. But the future is now. If you want to go on ahead and take a look at exosomes in your practice and offer it as an upgrade to some patients. Now I want to talk about a couple antagonistic things, and that is chemical peels. Microneedling already gives you an outstanding exfoliation. You get this perforation sheet that you see here on the skin, and all those little islands of dead cells in between the dots is where the skin will flake off. And a pH of 2, when delivered all the way through the stratum corneum to the epidermis, does not help the healing process. It is not what we want to do. And these acids have very low pH. So save the peels for when the skin is intact, in between your microneedling treatments if you really want to, but definitely not in the first week after doing one. Another one I talked about last time is using energy on the needle tips. Again, why do you want to heat and coagulate all of these beautiful proteins that are going to help make scarless tissue over time? Instead, what you're trying to do is coagulate these key mediators and make more scar tissue in the short term. Again, I don't understand it. It's painful. It's expensive. Combining them together is in my opinion, wrong. And I would never go there, even if they gave me the machine. It's unnecessarily deep. It's not really going to generate collagen and elastin that's healthy, that's going to move. It's going to be scar collagen. You're coagulating your growth factors, and you're even contracting some of the fat. So that's a no-no. Finally, I ran this through our patient database just to kind of see, and I was really surprised at some of these numbers, and that is, how many of you already do Botox and fillers in your practice if you are able to, if you're an RN or above? If you don't, you might want to do it, and I know somebody who can train you in it and make sure you're better than everyone else in your community. But anyway, 75% of my microneedling patients also get Botox, 43% get dermal fillers, and 35% also get PRP. So again, it doesn't matter how they enter your practice. They enter through Botox, they become a needling patient. They enter as a needling patient, you do a great job, you can end up selling other products to them. And that gets you a practice where you don't have to advertise anymore. In total, 73% of all of our microneedling patients first got Botox fillers or PRP from us before getting needling. So it's a great entry door for any aesthetic practice. So again, you can learn that stuff from us if you haven't already, or if you took a course and you're not practicing it because you don't feel well trained. You can do our online course first, and you can see the number of hours there. And if you want to do hands-on again, all of the live hands-on courses at the link in the messages, those will give you the online access as well. Those are the locations around the country where we do hands-on. Finally, this page, which I've linked as well in the messages, is our information site for the Dermapen 4 or DP4 CME training course. You can stream it at your own pace. You can see on the screen what it looks like. You can jump around to different slides. It's got lots of blue clickable links. You can ask questions at any time through it. And then when you have completed the course, you can take a post-test and print your 3-hour CME certificate. You will also get 2 years of access with free updates. We've already updated the course 3 times in the last 2 months. And you can read the drop downs on there for the accreditation statement and also the full course outline to see what we're covering. But you are going to learn something. Even if you've done dozens and dozens of microneedling treatments, you are going to learn something. In addition to the Get 40 CME discount code that you can use at the DP Derm site to order the course, you don't order it through Practical CME. You can go to that page to read the full outline, but you order it through DP Derm. Use Get 40 CME with DP Derm, and you will get a discount on the course. But also, when you order the course, embedded in the course is a discount for other Practical CME training. And this week only, that discount coupon inside the course will also be good for hands-on. In the past, it was only good for online training, like the online PRP course or Botox course. Now it's good for hands-on training as well. So you can go to any of our 10 cities for that. So I'm going to leave it there, and we'll start to take some questions through the messages. And Kevin asked, have any of your patients requested PRF? Oh boy. Okay. So we talk about this in great detail in our PRP course. And that is the preparation of PRP is FDA cleared, requires FDA cleared equipment. And it requires drawing blood under anticoagulation. So the little gel tubes, or if you're drawing it into something else, if you're drawing it into a syringe, you have to have anticoagulant. Because when you spin it, the cells need to be freely flowing. It can't clot in the tube. And that's the only way you're allowed to concentrate everything into that one little line that I showed you back here. What has happened is some companies out there have decided, and I honestly don't know why, to circumvent the FDA and have people draw bloods into a tube without coagulation in it. So as the tube is spun, everything coagulates, but the problem is there isn't time for separation to occur. So what happens is you're just letting whole blood naturally clot in these what are called PRF devices. And what you get when you draw the goo off the top is you get something that actually is quite devoid of growth factors. And one of the companies out there, Cosmo France, has a line of PRF equipment. And the one published paper using their equipment actually showed a reduction in platelets in their product than in whole blood. And by definition, platelet-rich plasma, rich, means you have to have a 4x concentration of platelets in what you're injecting back to the patient, because that's where the growth factors are. So by taking that goo off the top, they're calling it a biofiller. Well, it's not going to last but hours in the tissue, and you're not going to get the trophic effect of growth factors. So whenever something is labeled PRF, that is something I would stay away from. What we put in the skin is called activated PRP, meaning you spin it, you take out the growth factors, and then you injure it outside the body to make the growth factors release. That will clot in a matter of minutes, but you've already injected it into the face. And so the growth factors get released and it firms up and stays where it's supposed to be. And then, of course, it gets taken away. And remember, we talked about exosomes. Well, platelets have exosomes too. And so all those exosomes that are made by the platelets are actually getting embedded in the tissue and acting on the tissue as well. And when you put PRP on top of fresh dermal filler, the fresh dermal filler acts like a sponge. And so these exosomes and growth factors get taken up by that dermal filler implant, and it acts like an implant of growth factors. So that's why the whole concept of PRF is a problem. Now, I have yet to see any FDA jurisdiction over PRF. So I guess if you want to try and enter this industry and not have to worry about the FDA, you just take a plain glass vacutainer and fill it with blood and try and convince people that it's the same thing. Just like they call microneedling with RF, they take the term microneedling because people know it and love it. They take the P and the R out of PRP, and they want people to think it's just as good. So yeah, you pushed a button there. But that's definitely a problem. It's got to be PRP. It's got to be spun anticoagulated. It can't be spun as whole blood, or you're not going to get any concentration. Any other questions? I know that's a lot of information. You know, I start researching these presentations, and it's nice and small. And then the last couple days before, I keep throwing stuff in, but hopefully you can watch the replay, including the part where we got struck by lightning, and learn some more. And of course, I would strongly suggest, if you've learned anything from this, imagine how much more you're going to learn in 3 hours, especially if you already own the DP4 device, because the training course is going to tell you a lot more on how to select and use the products at your disposal. And remember, it's not adding any cost to the procedure compared to the alternatives. Any other questions? I just saw Kevin's in my chat. Hopefully I'm seeing everyone's chat. I don't see any right there. If any of the moderators see any, if you could just relay them to me. If not, we'll close up there. And I will look forward to seeing you again in a few weeks. And we'll release a schedule with some more topics then. All right. Thanks a lot. Enjoy the rest of your Wednesday. Good night.
Thank you.
Thank you, Dr. Zengo.
Thanks. Appreciate it.
Thank you, everyone who attended.
Thank you.
Don't forget, everyone, there's 40% off of the CME training course with discount code GET40CME. You can find the code in the chat, and we'll also follow up with an email to all of the attendees and anyone that registered. Thank you.
All right.